Carla Easter to please come up. She's going to introduce, Carla is from the Division of Policy, Communications, and Education, and she's going to introduce the next speaker, Dr. Richard Haspel.
Wonderful. So good morning. So I would just like to introduce Dr. Rich Haspel, who will be giving the next presentation, which will be an overview and update of the Inter-Society Coordinating Committee for Practitioner Education and Genomics. And so Dr. Haspel currently serves as the chair of the ISCC-PEG. He is also a guest researcher at NHGRI. He's a faculty member in the Department of Pathology at Beth Israel Deaconess Medical Center and also assistant professor of pathology at Harvard Medical School. And so I will now turn it over to Rich to give his presentation.
Thank you, Carla, for the introduction, and I want to thank NHGRI for this great opportunity to talk a little bit about what we're doing with ISCC-PEG. So might as well start with what it is. So it's a long name. I won't say it again because Carla just said the whole thing. Easier to say ISCC-PEG. But it was formed in 2013 from the Genomic Medicine 4 meeting, and it's supported by the NHGRI Division of Policy, Communications, and Education, in particular, the Education and Community Involvement Branch, which Carla leads, and that's why Carla and Donna Messersmith are two of the key people working on ISCC-PEG. And in terms of our membership, we have over 160 members with representatives from over 80 organizations or NIH institutes. We have 24 individual members and give or take 10 industry members. We're always looking for new members, so if there's anyone here who's interested. And we also have some international representation. So again, as a first step, I just want to say a big thank you because this is supported by NHGRI, and hopefully I'll be able to show you some of the stuff we've been doing with your support. And in case you're interested, this is what comes up when you Google thank you and DNA. You get a thank you card available on Amazon. So anyway, but thank you for your support. So this next slide, I have to give some credit to my daughter who helped design it. It's hopefully give you a view of the breadth of ISCC-PEG membership. So here are the logos and stuff of, this doesn't even include all of them, but most of the organizations that are part of ISCC-PEG. And what you can see is there's a wide variety here. We not only have physicians from different groups, we have nurses, we have pharmacists, we have the different NIH institutes. So again, this is really a group that is made up of a lot of different people, all with an interest in genetics education. So now, getting more to the logistics, what do we do? Well, it's kind of like a Venn diagram. The first is this is all in the overarching goal of collaboration. But first, we want to determine needs and create useful resources for genomic education for healthcare providers. And we also want to be able to disseminate and learn about best practices. And of course, these two things overlap. So the way it works is there's one NHGRI and one outside co-chair. I'm the outside co-chair, and Carla Easter is the NHGRI co-chair. As I mentioned, we have a lot of different membership. We have the Organizational Institute, we have industry, we have individual members. And because we are involving all these diverse groups, in the last year, we came up with a policy to make sure that we ensure independence in ISC activity. Things like conflict of interest and things like that. So there are no dues. We have conference calls every other month, and mainly we use this for members to provide intros, like if we have a new member, or updates about things that are going on in an organization. And we also have updates about our project groups, which I'll talk a little bit more about. We also, thanks to NHGRI support, we have an in-person meeting once a year. It's held at NIH, but we set it up so people can also call in and watch what we're doing, sort of like you guys are doing here today. And we have a website that hopefully provides information about ISCC-PEG. And again, we have these project groups that have these conference calls to try to create resources, which I'll talk more about. And another thing we started in the last couple of years is a compendium where we have people giving updates on calls, but you can only do so much on a call. So we've created this compendium where members can submit entries about what they're doing in medical education for genetics professionals. So that's another resource to try to make people understand what everyone's doing and how we can collaborate. So I don't know if any of you have seen demotivation posters, but this is one of my favorites. Committees, just like teamwork, only without the work. So we'd like to think with ISCC-PEG, we are a true teamwork where we actually do some work as well. So we've created some useful resources. For example, this goes back a little bit, but there were competencies developed, published in 2014, about what healthcare providers should learn about genomics. And we've had webinars, we've had educational cases. I'll talk a little bit more about these universal exercises that were developed. And we've also contributed to existing projects. So one of those is G3C, which I'm hoping many of you are aware of. So for those who aren't, G3C is this great platform that has educational modules to teach about genomics. And we were fortunate enough through ISCC-PEG to contribute to this existing platform and successful platform. And there's now a hypercholesterolemia case, and we had one of our cardiologists, our AHA representative to ISCC, helped with developing this case. And our National Society of Genetic Counselor representative, while this wasn't their area of expertise, they pulled from their cardiac working group a representative, someone to help develop this case. So I think this is a good example of how we can pull people with different expertise to make educational resources. And this is just a picture. It's really neat, this website, because they have actors and actresses who come in and pretend they're patients and you can look at their histories and things like that. So if you get a chance, you can check it out on the website. Another tool that we've created that came from a working group, that was a project group called Innovative Approaches, were these universal exercises. And the goal here was to create something, because again, this group is made up of people, some are interested in cardiology, neurology, psychiatry. So how do you create a resource that might be useful for all these groups? So we created basically these plug-and-play modules. And the way, so there are 4 exercises, and it was based on some work that had previously been done in a cancer genomics curriculum. So it starts with single gene testing and then works its way up bigger and bigger to like whole exome sequencing and polygenetic testing. And the idea is you have a module, and what I said, it's plug and play. So there are key things that the group putting this together thought should be covered, like list 2 criteria to guide the selection of variants that should be on the gene panel for your patient. But then we said, well, pick a disease that is important for your specialty, pick the genes of interest, and here's a question where we said, find gene panels and have a laboratory 1 and laboratory 2. And one of the goals of this exercise is to compare how one company might have a gene panel that has certain genes, another company has different ones. How is that decided on? And again, this also utilizes tools like OMIM, ClinGen. So again, the core thing is every healthcare practitioner should learn how to use something like ClinGen. This provides a model where an instructor can plug in the genes and diseases they want. And there's also a detailed handbook and toolkit that's about 60 to 80 pages, has all the PowerPoint slides and instructions for implementing this. And as part of that is we actually received a supplement to an NCI grant from NHGRI to help fund this. And we've since had workshops based on this universal modules at the American Heart Association annual meeting, the American Academy of Ophthalmology annual meeting, and the American Academy of Neurology. So each of these, we had physicians who took the modules and adapted it to their specialty, and then led a workshop, a team-based learning workshop, interactive workshop. People bring their computers and actually get their hands dirty using websites. And you can see one of these workshops was published in Cardiovascular Genetics, the Circulation Journal. So that gives you a few of the things that we've done in the past. Now we have some active project groups, and I'll talk about each of these a little bit. Project Inclusive Genetics, Pharmacogenomics, and Direct-to-Consumer Genetic Testing. We have 2 other groups that are sort of getting off the ground. One is about promoting diverse healthcare professional patients and caregivers. through inclusive outreach, so trying to get more of the patient side. And this is one where definitely Carla is one of the co-chairs, and we're looking for another co-chair. But the idea is, how can we integrate some of the work that ECIB is now doing with patient groups and create some useful resources? Because obviously that perspective is incredibly important. And more recently, we had a presentation about forming a rare diseases project group to create resources. And this was from Michelle Snyder, who's involved with GUARD. So we're hoping, again, this would be a way for things going on at NIH to collaborate with ISCC. And we're always welcoming new project ideas. So a little bit about Project Inclusive Genetics. This is chaired by Shumita Dasgupta. And the project was very focused to begin with. It was saying, let's look at bias towards individuals with disabilities in the setting of prenatal screening. So how many of you, I don't know, I guess I can do this, not that everyone can see. How many of you have heard of an implicit association test? Okay, a few people. Well, if you have a chance, Google it. There's a website where you can take these tests, and they're really fascinating because the goal of them is to uncover hidden biases by how fast you respond to different topics. You should check it out yourself. But the idea is, Shumita and her group said, let's create an IAT related to this very specific concept of bias related to disabilities. And let's, around that, because you can start by the learner doing that IAT and saying, wow, I have maybe some biases I wasn't aware of, and then have them have a teaching module to build on that. So basically, Shumita is almost done with this project. Fortunately, it was great. We were able to get some funding through ECIB to help complete this, and it's almost ready for release. So the IAT is ready, the module's ready, and we're hoping to distribute it through the ISCC membership. Another working group chaired by Andrew Monti and Donna Messersmith here at NHGRI is about pharmacogenomics, clearly a very important area. And the bottom line is they're hoping to create resources to help teach people about this area. And they've so far created a module, a web-based module to teach about pharmacogenomics in the setting of Plavix. And what's really nice is this went, just like the Universal Exercise did, this underwent outside review, so it wasn't just, local. And it's almost ready for release. And the American Academy of Family Physicians is very interested of taking this and putting it on their website. And hopefully, possibly, the AMA is also interested. So this is moving along as well. And the last group I'm going to talk about is the direct-to-consumer. Everyone knows how this is in the news. This is happening. In fact, it made the 15 for 15 that was done for National DNA Day. And this again, it's about creating resources for physicians about direct-to-consumer testing, because the bottom line is people are doing this testing and they're going to go to their primary care provider with their printout and ask, what do I do with this? So Kathy Blazer and Tracy Weiler have been very involved with this. And as a first step, just like with any educational initiative, it's good to do a needs assessment. So working with a survey that's being done by ECIB to look at an overall needs assessment for healthcare providers in education. We're going to have some very specific questions related to DTC. So we can really get an idea of where do healthcare professionals feel they need help, and then based on that, develop some resources. This is just a little bit about the compendium. Here's just a table of contents to give you an idea. A lot of our organizations basically have put entries, and what the entries consist of, obviously the name of the person entering it, what are some of the active educational programs being done by the organization? Would someone be interested in presenting these at a meeting or on a conference call? Would someone in your organization or you be interested in leading a project group, because we want to get those things going? And any other ideas for ISCC? So again, this is a way that instead of having to go to all these different websites, I'm wondering what this group is doing, they can go to this compendium and say, they're working on this. That's something interesting for our organization. Let's see if we can collaborate. And it's still in its early phases, but we're hoping this will be another way to build collaboration. Another thing we just actually started to promote interaction is a Google Doc. Basically, we're starting off just for a way to list meetings. So people could go here and they could see meetings that different, because To have a listserv, we'd be sending out emails to people all the time with different meetings, and it would drive people crazy. So it's much better, let's have a list people could go to, and they can enter their meetings and contacts and things like that. We're thinking of ways to build this through like a Google Drive, like an ideas or suggestions doc, maybe put our meetings up on a Google Drive, things like PowerPoint presentations. So just another way we're trying to promote interaction. So I know this is a hot topic in NHGRI, and we at ISCC-PEG wanted to contribute. So we put together this letter from our group to Dr. Green. And I don't know if, hopefully you can see, we had a quote from Dr. Green from, a little bit old. But the great thing is that NHGRI has lived up to this idea of trying to do education. And we, though, had some additional ideas for maybe promoting education through NHGRI. And another quote we put in this letter was also from JAMA. And as with the practice of medicine, the best hope for understanding the quality of current educational techniques and for evaluating proposed new approaches is by conducting and disseminating research based on sound principles. So the reason we put this quote is it used to be that people thought education was something, you put a course together, two people sit in a room and they put a course together. Maybe they put some multiple choice questions together and you have a course. Medical education is now being recognized, hopefully recognized, as a medical education research specialty of its own. There are key principles and solid evidence-based techniques for developing coursework, for developing educational modules, and for evaluating. There's a whole field of psychometrics just dedicated. Before I got involved in this stuff, I always wondered, how when you take a board exam, how do they know you're actually qualified? There's a whole statistics around this. And now more and more universities or medical schools, for example, have tracks that are related to medical education. And it's not just, I teach in these courses. You have to demonstrate scholarship. You have to publish. You have to do projects and research. So with that in mind, we'd like to we have some ideas for how we can encourage those best practices in medical education beyond just sort of tacking on like, you should do some education related to this. How can you do the best possible education? So with the caveat that I am not from the NIH and I'm definitely not an expert in grant funding mechanisms, my understanding was that it's often easiest with NIH to work within existing frameworks. And one that I've actually been involved with, or I have a grant, is through the NCI and their R25 pathway. So one suggestion we had was maybe to build something similar to the NCI pathway. So as you can see, they have two PARs. One is about just to develop a curriculum. It's not even about having the course. It's about recognizing that it takes time and money just to develop a good educational resource. And then they have a second grant up to $300,000 a year over 5 years to actually implement a course. So again, the recognition that just like an R01 and research, doing good research takes money, putting together a good educational program does take funding and people with expertise in medical education. And there's a whole variety of projects, for example, that ISCC is working on now that could potentially lend themselves to applying for this grant. Another another grant that NCI, they have these research experience grants. And what we were wondering is, as many people know, this is to encourage people to go into primarily research careers in cancer. But we were wondering, and that's very important. It'd be very important in genetics and genomics as well. But we were wondering, it is very clearly recognized there's an incredible shortage of genetics professionals in the United States. There aren't enough genetics counselors and geneticists, and there's more and more patients that have genetics issues. So could you create a program where you provide an experience for like an undergraduate to say, look, here's a career in genetics. This is what it means to be a genetic counselor or a geneticist. Or for medical students to understand. I went through all of medical school. I never met a geneticist. And we have some survey data to say a lot of medical students aren't meeting genetic counselors or geneticists during their medical school training. So maybe this could be a way to at least they know, because you can't choose a career pathway if you don't know anything about it. So again, that could be one potential idea. Another thing would be already practicing healthcare providers to provide them more immersive experiences in genetics, like working directly with a genetic counselor or geneticist to figure out ways they could better integrate genetics into their practice. So again, these are just some ideas. The great news is you guys are already providing funding for courses. And this is the PAR that's been sent out. I guess we're just saying here are some other ideas and ways to expand upon that, to really create the best educational resources and also develop a workforce that can actually implement all the great research you guys are doing. Because again, we also have data, some of the work we've done, most physicians, I can speak for physicians, know very little about genetics and how to implement it. And NHGRI could really help and provide funding to create really solid resources beyond just a webinar or a few lectures. And just a little bit more about these NCI programs. There was a publication that came out. Full disclosure, I was a co-author on this for our NCI grant that we have related to training pathologists in genomics. And as you can see, one of the quotes from this paper is the implications have been far-reaching, benefiting more than 3,200 program participants at various career stages. And as I mentioned, the Universal Exercise Project was funded through an NHGRI supplement to the existing NCI R25. And it's this one that I was involved with about training pathologists and medical students in cancer genomics. And the thing is, when I went to my program officer and I said, so can I use some of this money for like cardiology, or ophthalmology? And they were like, no. So fortunately, we were able to work out this supplement where we got some additional funding to create these modules, and we've had these sessions and publication. The bad news is that NCI would not do this anymore. Okay, they would not contribute money now for this thing because it has. My understanding is because it just didn't have anything to do with cancer. So one question, as I'll show on the other slide, is there a way to still provide supplements then for people who have existing grants? Because so many projects funded by the NIH involve genetics. So wouldn't it be great if there could be supplemental funding to harness the educational aspect of that? And that gets to inter-institute collaboration. Again, caveat, I am definitely not an expert on these different programs, but they just struck me as ideas of examples of how there's collaboration on issues that span across NIH. And I would make the argument that genomics education spans across the NIH. So some of you might be aware of the PAIN Consortium, which is to promote collaboration among researchers across the many NIH institutes and centers. They have this HEAL initiative where joint RFAs are released. So again, something with genomics education would maybe have interest from a variety of NIH institutes. And again, the question, could this be a model for genomics education? I know there are a lot of other priorities, but obviously I'm a little biased here. And again, this question of supplements, because what we did with the NCI probably couldn't be done at this point. Is that something just to figure out how that could perhaps happen in the future? And here, just because I know the NCI stuff a little better because I get their emails because I have a grant from them, is they have what they call NCI Awardee Skills Development Consortium Research Education Short Courses. And the idea here is NCI, like NHGRI, has people, for example, on T32 grants or R grants. So why don't, instead of just tacking on a little thing to the T32 saying, you have to educate people or something like that, where you say, let's get experts in education to put forward proposals about how they're going to create something for people on these grants. So provide opportunities for current NCI grantees to enhance their skills in areas that are critical for successful independent academic cancer research careers. So the idea, if NCI is doing that, is that something that might be reasonable for NHGRI? And it might not only apply for K or R grants. What about consortia? Things like Ignite or ClinGen or the Undiagnosed Disease Network. These are all things where my understanding is there's an education component. We have to get the word out about these things. Let's stop necessarily assuming that just because you're working on genomics or just because you went to medical school or grad school that you know how to teach. There are people with expertise in this area, and if we can bring them in And it's not like we're talking about zillions of dollars. It's just providing them some support to create really very evidence-based, solid educational tools to help support some of these consortia and other grants. Other possible funding ideas, again, these really, there isn't a quote unquote mechanism, but the thing with education, it doesn't always take, $1 million. Even small awards can go a long way. So for example, that project Inclusive Genomics was able to get some money from ECIB to help bring a programmer in to make that implicit association test. The thing is, currently there's only an invoice method available for that, and most educators can't put the money up front and then invoice for it. So if there was a way to have small grants for education, might be useful. I think looking at some of the ELSI grants that have been awarded, I think there are definitely ethical, legal, and social implications involved in medical education, like DTC or things like that. So there might be opportunities for ELSI grants for some of the education work. And again, very biased because I'm from ISCC, but I hope you'll continue to fund the ECIB and ISCC. But they're obviously doing great work, and I'm hoping, that will be. We are hoping as ISCC that will be able to continue. So Dr. Green kindly sent us a response, which we appreciate, and I will just say that we want to help with the strategic planning. I understand that there's a lot of issues here, and we of course have some tunnel vision because we're interested in education. But again, I would think all the stuff that NHGRI is creating will only go so far if you don't have good ways to implement it and educate people about it. And why not use, just like you have experts in genetics, why not utilize the expertise of people in medical education? So some future plans. There's some logistics we're working through. We're working on creating a disclaimer. So one of the benefits, or one of the things that's come up, is when people create resources, just like when you guys publish papers, you have to have this disclaimer. Like, we don't want what's out there to be like, oh, this is what NIH is saying. So we're working on creating a disclaimer, and basically we think it'll just be based on the standard disclaimer, but instead of saying insert author's name, it would say this does not represent the views of NHGRI or the ISCC-PEG. Part of that is we're working on how do we review these resources? How do the co-chairs of ISCC review resources and make sure that, we're not experts in every area of genomics, but we also want to make sure there's some oversight. So that's something we're actively working on. I mentioned tweaking the website. Some of the links don't work and things like that, so we're going to try to tweak that. Mentioned the Google Drive. And the other thing is a logo, because lo and behold, a few months ago, what comes through my email? That there's another ISCC. So that's why we're going by ISCC-PEG now. We used to call ourselves ISCC. And it'd be really cool if we could have our own logo and kind of separate ourselves out, and because they beat us to the punch. So any way we can distinguish ourselves from this other group would be great. Always looking to expand membership. We'd like to figure out ways that members can spread the word. We're hoping to create tag-on slides that if a member gives a talk somewhere, they can have one slide just saying what ISCC-PEG's about. And we're looking into ways to have more of a presence at like genetics and health professional meetings. Of course, support the project or working groups, new ones, develop resources, help support the current. And of course, as I've talked about, thoughts on strategic planning. How can we help from the perspective of health professionals? We have quite a diverse group. As I mentioned, all different sorts of health professionals in all different areas. We're very happy to contribute, not just about education, but other aspects where we can provide some input we'd be happy to help. So just to sum up, there's a picture from our last in-person meeting. We have the website. So we really have a diverse membership, and I think it brings a lot of input and a lot of perspective when we're discussing things or when we're creating resources. As I mentioned, forum discussion, developing resources. We're always looking for new opportunities, and that we want to help with strategic planning. And a lot of thanks, of course, to NHGRI, of course, Carla and Donna, who are really the backbone of ISCC. Also, Christina Dalton and Charisse at NHGRI provide incredible support. Laura Rodriguez, when she was here, was really very supportive of ISCC, and Dr. Manolio was co-chair with me for when I initially became co-chair, and she has been an incredible help with advice and moving this stuff forward. So thank you. So again, I really appreciate the opportunity. I'd say we at ISCC really appreciate the opportunity to just talk about what we're doing and some of the ideas we have. And if we have time, I'd be happy to answer questions or discussion. So thanks a lot. You want me to just call on people? Is that right? Yes.
Thanks a lot for that, and to your daughter.
Oh, thank you.
So,
I'll tell her, yes.
Thinking about that one slide with all of the organizations that are part of your group, I'm really struck by the certainly the value of evidence-based educational tools. But I also can't help but think of what's racing ahead right now, so I wonder if you're collaborating or if you have been in touch with the companies like Color, like Invitae, like a ton of testing companies that do offer to provide education. You can have sequencing, you can have a panel, you can have, depends upon what your needs are. But they are very quick to say, and we have education for general practitioners, we have it for whoever you want. So I'm very curious because I don't know if those are evidence-based, and I actually think they may be good, but I don't think they are evidence-based. And so I wonder if you comment on your collaborations, if there are some, with the companies that are selling testing.
Right. So the question is, industry, essentially, they provide educational support or they provide education. So actually incorporating industry members into ISCC is fairly new. So I don't know, maybe it's been probably less than a year. And that was one of the things we decided to do because they have unrestricted educational grants, and wouldn't they like to be on the table with people who might want to create education? So it's still in its very early phases. You might have noticed we do have some groups up there. We have 23andMe, we have Illumina as some examples. They have representatives too. So it's a work in progress. The one thing, and that's why we had to put together a whole document about conflict of interest and how they could contribute, because having someone from a DTC company on the DTC project group, we're creating CME, we can't do it. So it's taken a lot of thought about how to do that. It's still in its early phases, but ultimately that's exactly what we're looking for. But less the resources they would create, but the fact that they have unrestricted educational grants where they say, here's money, we're not going to keep our hands off. If we can connect them with people who want to create things, that's our goal. And I've reached out to some other companies. I'm hoping we'll be reaching out for more, but build that base, but also with a caution about conflict of interest and things like that. That's also, I'll just add why we added individual members, because we recognize there are people really psyched about genetics education and really involved academically who might be a representative of an organization. So that's why in the last year we've said you can be an individual member, because it used to be just representatives of organizations. So I hope that answers it a little bit. It's a work in progress, essentially, but something we're trying to do. Yep.
Thanks for the presentation. Fascinating. I guess I have two pretty different comments. The first is I've been part of the education committee briefly here and also as part of CSER, and I've been struck with how many modules have been created already. And so how is your organization really tackling the issue of how do we actually build stuff that people use and use on some, not like one-time rollout basis? Because I think that there is a lot of redundancy in tools, educational tools. The other, which I think is relevant to NHGRI, is as a PI of a T32, I'm very aware, not an AHRI T32, I'm very aware of the need for evaluation, but the T32 mechanism allows no salary support of that. And if there's some way, perhaps in a supplement process, which I'm not sure is possible under T32s, to really support T32 PIs in doing the kind of evaluation of their and plan and development of curriculum and evaluation, that would really be critical because that's a key source of support that's missing right now.
Right. So if I understand correctly, the first question is, you have a lot of things out there, but how do you know if it's any good and if anyone's using it?
And there are a lot of things already out there.
Right. And that is one of the key issues, is you have a lot of people creating things without a solid evaluation plan or being designed with best practices. I think I'll use the example from, well, I'll use two examples. One for those universal exercises. First of all, we had people who are experts in content and education who designed those. And as part of the funding, because we put together a formal proposal, we had buy-in letters from AHA, AAN, and the American Academy of Ophthalmology saying, we will have these at our annual meetings. So it can guarantee, and I think AHA has had it at the last 4 or 5 years. So it kind of guarantees, and we've had it at AAN for the last 3 or 4 years. So again, when you create something within a grant, like in the R25 from NCI, it includes, you have to show how you are going to disseminate this and show how people are going to use it. It also requires a significant evaluation plan that shouldn't just involve, well, we'll give them a feedback survey afterwards. So I think building a framework, well, first, through ISCC-PEG, at least we have people with interest in education working with the content experts to try to think beyond that. And then I think having the grant background, it forces you, just like an R01, you have an R01 to make people really think about, I'm not just going to put some test tubes together and grab some ice. You have to really think critically about it by having a grant funding mechanism. And that's why I found that really interesting, that NCI to tack on education to things like T32. I think that would be something where I believe that provides, I'll have to double check, but I believe that provides costs for like faculty, salary support and things like that. So the idea is you're recognizing that this takes time, that should provide salary support, and you have. But the nice thing is it's not necessarily always as much as something like a $1 million grant or something like that. So, someone else have a, yep.
Yeah, thanks for this important work. It really is critical and a much, well, can't say neglected, but ISCC-PEG was around for a while, but I think it's really critical. So I'm wondering what you've learned about when clinicians in particular are most receptive to education. I'm going to sort of make two guesses, and I'd be interested in some response. And one is the residents. And I noted at least one of the slides touched on pathology residents. But it seems to me that's a context in which students have been through an educational program where they understand a lot of the basic science. Now they're entering the clinical decision-making. How do these tools help them on the clinical side? The other, I think, might be the sort of just-in-time notion. You're a clinician, you're thinking about a genetic test, you don't know much about it. Where can I turn that's going to give me help with this specific technology and interpreting in this particular content? So I'm wondering whether those modes are part of where you're developing tools.
So I'll speak from, this is obviously personal opinion. And I think the best place to target education is medical school and residency and fellowship, because you have a captive audience. Okay. One of the reasons the grant we worked with it's from a group called Training Residents in Genomics. It was created by the Associated Pathology Chairs, and it's a working group of their committee on program directors. So we decided up front, you know what? The residency director says you have to be there for something. You got to go. So we first, because you can't do everything all at once. So we decided to focus on pathology residents because we knew we had buy-in from the pathology residency directors. They were a captive audience. And now we're doing the same thing for medical students to give genomics training through an NCI grant. So the idea is, I think that's really where you have to, I think if you want to get your most bang for the buck, that's really where it is. Practicing physicians obviously need to know this as well. So I think for them, I think just in time is important. I also think for those of you who are MDs, the whole maintenance of certification and CME, you need to get CME. I think there's this great book by Malcolm Knowles, which is called The Adult Learner. And a lot of people, that was part of the issue. A lot of people, when they were creating teaching tools, they assume an adult is like a kid. Like my daughter, I'll bring her up again, she's in algebra. Guess what? She has to sit there, right? Like, she has to learn it. Adult learners have choices. And a couple of things that Malcolm Knowles talked about, and again, one of the nice things about education, this is not rocket science, but unless you think about it. So he says, adult learners have to have a reason to be there, right? They have to know why it's relevant. They like having independent learning. They like the idea that they're not being told exactly what to do, that they can figure out things kind of on their own. So the idea is there's a whole literature on the adult learner. So I think, so some of the workshops we've done have been using team-based learning with the idea is you're going to have patients come into your clinic, or for pathologists, you're going to have specimens coming to you that you're going to have to deal with, whether you're at an academic center or at a community hospital. We're going to give you the tools to be able to handle these specimens, and we're not just going to lecture to you. We're going to give you cases, and you're going to work as teams to try to work it out. So it gives them control over the situation. So again, I think there's some literature from medical schools about how team-based learning works. Most medical schools don't even do lectures anymore. It's, people don't even show up anymore because they're filmed and everything. So the idea is, and also when you think about it, I mean, again, not rocket science, but now you have your iPad. Why sit in a room for an hour listening to someone spit out something like a lecture when you can do it at home? And why don't you spend time in the class actually practicing what they call performance-based objectives? We always focus on knowledge-based objectives, but what about performance, implementing it? So I guess to summarize, I think medical students, residents, and fellows are really a captive audience. And then for practicing physicians, I think on a very practical level, make it CME, make it something that, first of all, they can get credit for, but then also use those principles of adult learning to say, this is actually something you need to know. And there are ways to get that across. And it's not always perfect. But I'm not exactly for saying, oh, you get an email saying this organization's having a webinar. God knows if they're even watching it while they're, they log on and then they're probably doing whatever. So I don't know. Does that kind of answer it a little bit? It's a challenge, but that's sort of where, and that's why to give people experiences like with those research experiences, but experiences also for med students and undergrads, what it means to do genetics, I think are useful as well.
So this is just to follow on sort of what Sharon was saying. Do you have a best practices in terms of dissemination of the tools, or is there sort of a common place where people are going? Because I feel like there are a lot of parallel things that are going on, and I'm just not sure, even as an educator myself, I'm not sure where the best place to go is to get these materials. Right.
So so ISCC-PEG, because we're a mixture of a lot of different, that might be an interesting project we'd work on. Some of you might have heard of G2C2, which is an educational clearinghouse supported by NHGRI that people submit educational tools. And we're shifting actually a little. There used to be an editorial board that would actually review those tools and vet them before they would enter. Now we're actually going to utilize the resources of ISCC. So if a resource comes through, we'll ask some ISCC members if they'd be willing to review that resource. So that's sort of a clearinghouse. Unfortunately, though, I mean, it is something to think about for our group. We have all our resources obviously available, and part of the idea of having the compendium and things like that is to let people know about other resources. So within our group, we've tried to do that, but other than G2C2, it's kind of a hit or miss. You have to go to the different organizations and then review the material yourself and review the quality. But G2C2 is pretty good, and that's one of the things we're trying to do with that compendium, is make people aware of, because that is a big thing. But one of the things is one organization might not have any idea what another one is doing, so we want to bridge that gap. Any other questions?
Okay, Richard, thank you very much for a
Thank you.
wonderful
I appreciate it.
presentation. And to the council, we're going to break for lunch. Please reconvene here at 1 p.m. See you then.